Hello. Welcome to another episode of Simple Sommer Naturals.
I know you're used to seeing me, but this time you're just going to be listening to my calming voice. And I think that's a good bet too.
I'm your host, Dr. Kim Sommerville, your general practitioner and clinical nutritionist, and I'm here to share with you simple nutritional advice to improve your daily life. I want to share with you my passion for health, wellness, and nutrition, and I hope this can be beneficial to you. If you like my content or if you want to hear more, please give me a like, subscribe, and share with your friends and family. So on today's episode, I'm going to be starting a little series all about Polycystic Ovarian Syndrome. Something near and dear to my heart because I was diagnosed with it when I was 19 years old, and I have been living with it and researching about PCOS for honestly as long as I can remember. So if you have this or you have anyone you know who has this, please let me know in the comments so we can have a great discussion. So PCOS is one of those diagnoses that is really not one size fits all. For me, when I was diagnosed at 19, essentially it was really surprising because I went to the doctor because I was chronically tired. And honestly, when you know a little bit more about PCOS, you'd realize that that is actually a symptom of PCOS as well. So I was very tired. I went to the doctor. Essentially, she said I needed to sleep more. But I went to her and she asked me when my last period was. And I told her probably 3 months or 4 months prior. And she said, are you pregnant? I'm like, no, not doing anything like that. And she essentially said, hey, we're going to need to do a bag of tests. So I found this surprising because as soon as I started my period when I was 12 years old, my periods were always irregular. Sometimes coming 3 times for the month, not 3 times for the month, 3 times for the year. And, it seemed to be a normal thing in my family. So there was no investigations needed. Did a bag of tests just to find out that, hey, you have this type of diagnosis, you're going to be needed to put on birth control, and you may not have children. So of course I was devastated. I was 19, I wasn't ready for children, but just the prospect of having difficulty or not being able to have kids at all just taken away from me like that, that was a big issue for me. So fast forward more than a decade, I actually have a 5-month-old daughter right now who I'm so blessed to have, and I have done countless research on PCOS. I've actually done a research in Jamaica as well. I believe the first of its kind, and I want to continue to do this. I am also a part of the PCOS 1 in 10 JA social awareness campaign, and very proud of that as well. But just to let you know all of that, let's get into the meat of the matter. What is PCOS? So according to medscape.com, persons with polycystic ovarian syndrome have an issue with metabolizing androgens, also metabolizing estrogens, and how they control the production of androgens. So what does all that really mean? Essentially, Polycystic Ovarian Syndrome, or PCOS, causes problems with how you regulate your hormones. And once you have an issue with regulating hormones, you're going to be having some symptoms and some signs in your body that lets us know this. So here's how you actually get diagnosed with PCOS. So we're going to need 2 out of 3 of these characteristics before we can say, yes, you have PCOS. And mind you, some persons may not even have 2 out of 3, but they have other signs that are really directly linked to PCOS. And hence, we as doctors may take it upon ourselves to treat this person like they have PCOS. Anyways, here goes. So first, you're going to have irregular menstrual cycles. What this means is that usually from the start of one menstrual cycle to the start of another is going to be around 21 to 35 days. So if you have your period more than 35 days, sometimes even 2 or 3 months may pass, then you are likely to have irregular menstrual cycles. what this may look like is that you have less than 9 periods for the year. Of course, if you're thinking that, hey, I should have 1 period a month, you should at least have 11 to 12 menstrual cycles for the year, right? So if you have less than that or less than 9, then we'd characterize you as having irregular periods. 2, you're exhibiting some amount of high androgens. And androgens are usually called male hormones just because men tend to have more of these hormones than women. But women do have androgens as well. It just should be under a certain level. So how do we know if you have high androgens? Well, what we can do first is actually look at the signs on the body. So one sign is that you may have high amounts of hair growth on the body, right? So other than the scalp, you may find that you have a lot of hair growth on your chest, on your lower abdomen, could be your chin as well as your mustache area, or even your hands and legs have more hair than usual. You may also have thinning of the hair on the scalp because that tends to happen with men when they have a high testosterone as well. So of course, that would be seen in women who have polycystic ovarian syndrome too. Also, you may have a very high amount of hormonal acne. And usually we see that on the lower aspect of the face. So that's like the chin and the lower jawline. You can also have it on your chest, on your back as well. May be considered having high androgens. And if you have none of these symptoms, then your doctor may do some blood tests and see whether or not they're high. And lastly, number 3 is having polycystic ovaries when you do an ultrasound. So your doctor is going to want to do what they call a pelvic ultrasound or a transvaginal ultrasound. What that is that they're looking at the lower abdomen, or they're using the ultrasound probe to look inside the vagina. They're going to be looking specifically at the ovaries. And if you have a lot of follicles, these are certain things that would be produced if you're starting to produce an egg in your ovary. A lot of these follicles may build up and they may be on the outer lining of the ovaries, and that would let us know that, hey, this person has polycystic ovaries. But funny enough, you don't actually have to see polycystic ovaries on your ultrasound to be diagnosed, because as I said, it's 2 out of 3 of those factors that you need to actually get diagnosed with PCOS. So if you really think that you have these type of symptoms and you haven't been diagnosed yet, honestly, check around. There are other doctors out there who may know a little bit more about PCOS and will help you in your diagnosis. But trust me, don't give up. We take a little break now to hear a word from our sponsor. It's me. I'm the sponsor. But seriously, if anyone wants to sponsor the Simple Sommer Naturals podcast, please give me a message at simplesommer.naturales.com. Or you can email me at sommer.naturales@gmail.com. If you're trying to lose weight or control your blood sugar and you're really tired of counting calories or weighing your food, this is right for you. This is the Ideal Jamaican Plate Guide. It's a mini ebook with 4 easy steps to control your weight, control your blood sugar, and have you feeling more energy and more like yourself in no time. It has details on the types of food that we can eat that are very similar or very normal in our Jamaican diets. Nothing restrictive, just adding on the healthy foods that will get you to your goal. Ideal Jamaican Plate Guide is available at simplesommer.naturales.com. And we're back. So we're talking about PCOS and what it is, how do we get diagnosed, and now I'm going to be discussing what type of complications can arise if we have PCOS, because essentially we want to know, why is it important? Yeah, I don't get my periods often. Sometimes we're happy for that. Sometimes we even take medication to stop our periods because of whatever event is going to happen. But Why is it necessary to actually get your periods regularly? Why is it necessary to not have high androgens? All of these things should be known so that we can know the importance of why PCOS needs to be looked at and needs to be treated. So there's some complications that I want to touch on, and the first one that is the most talked about actually is infertility. So by the definition of infertility, it is that you and your partner are having sexual intercourse for at least 3 times a week for over a year without having conceived a child. Because a lot of the times, partners may be trying to have a child for probably 3 months, not seeing it happen, and then you say, hey, I must be infertile. No, it's regular sex for almost a year before you can say you're infertile. But the thing about this is that it is common with women with PCOS just because you may not be ovulating each month as you should. Remember when I said that, there are usually a lot of follicles on the ovaries when the doctor does the ultrasound? Those follicles come about because the eggs in your ovaries are not being produced as they should, and you're not ovulating. It doesn't mean that a woman with PCOS never ovulates. It just means that we don't do it on a regular scale or a regular timing. So the timing of which we can actually get pregnant with the sperm from our partner is a little bit tricky. But hope is not lost. Some women, a lot of women actually get pregnant spontaneously with PCOS, but others do need to have their PCOS treated, speak with a fertility doctor, and have possibly interventions that are necessary for the development of a pregnancy. But it is possible. The next complication is obesity. Usually PCOS is associated with persons being overweight or obese, and that usually is because of insulin resistance. Insulin resistance is a type of PCOS, or one of the causes of PCOS actually, and I'll be discussing that more in our next episode. But obesity tends to happen in PCOS for about 50% of persons, and it tends to be that it's more difficult to lose weight. As I said, the doctors, when you're diagnosed, would usually say, hey, go exercise, go eat right. But that's a little bit vague, right? And when you're exercising and eating right to lose weight, you realize that, hey, you're not losing enough weight, you're not losing weight as fast as you'd like, or you may not be losing weight at all. And you get frustrated, and it's a whole cycle, right? And you may even put on weight because of all the stress and frustration from this healthy, quote unquote, journey. So yeah, obesity tends to be a little bit difficult, but it can be controlled when you know the types of PCOS and how to manage it directly from that. So again, look out for further episodes. We're going to be getting into that and all the nutrition and exercise and stress management necessary to really get this PCOS under control. Some other complications that are worth mentioning are high blood pressure, type 2 diabetes, high cholesterol, and mood disorders like anxiety or depression. There are a lot of other complications out there, but these are the most common. And yes, it is a lot. PCOS in and of itself is sometimes pretty overwhelming. But if you have a doctor that can advocate for you, a nutritionist, a good team around you, even if that's not necessarily professionals, but more of a support group, that will make a world of a difference in your PCOS journey. So if there are any questions that you have for me related to PCOS, or just depending on health and nutrition in general, please let me know in the comments or send me an email, and I'll definitely discuss it on my podcast. Thanks so much for listening. This is Simple Sommer Naturals, giving you simple nutritional advice for your daily life. Take care.